I have a couple of questions. I just to follow up this in terms of registration. I would say probably one of the most frustrating, confusing parts of trying to get a vaccine, at least where I am, is for people to sign up for the vaccine. Uh, there's been a lot of different systems. In the early days, a lot of the systems crashed. The people who don't have computers were not able to even sign up. If you could just comment on that, is that part of your responsibility to try to get these registration systems up and running well?
This is Jennifer. I'd be happy to share what's happening in Connecticut. So, there are a lot of moving parts, and we do need a federal mechanism to monitor and track vaccine and first dose and second dose and allocations and that sort of thing. So I appreciate all of that. But for the recipient, the end user, we have not taken them into account when we develop this vaccine administration management system and the need to register through it. It's been very cumbersome. In my jurisdiction in particular, as the rollout started for beyond first responders to population 75 and older, we had to abandon that system for them. We still use it, but we had to engage the people that they're used to working with, their senior centers, their municipal partners, so they could simply pick up the phone and make an appointment. And then we worked with those agencies to capture the data we needed. But then this required a lot of back-end data entry on our part. But it was a necessity if we were really going to reach those vulnerable populations. Many of my colleagues across the country are working on similar workarounds. Health systems that have electronic medical records, I think, have an easier way of doing this, but the majority of local health departments, one, don't have a mechanism to bill for administration of this vaccine and or to use those electronic medical records. So it's taken additional resources, but that's the work that is our responsibility as we work to get vaccine into people's arms.
Well, thank you for that, Madam Chair. We don't have anybody. I think from the federal agency on today, but I do think that the situation which I described and our presenter described is very common, probably across the country, and I think there needs to be some federal response to this.
Well, just for 1 second. Yesterday we did, and with the roundtable, we did with Dr. Walensky, Dr. Schuchert, and Messonnier in terms of the federal piece. But you're right in terms of suing where that needs to go for that.
Yeah, but I think just in terms of this whole register, people registering the vaccine, it's been a mess. Okay, get another. Do I have myself?
Yes. Okay. No, go ahead.
Okay. On the issue of the disparity in the salaries, could somebody give me an example of what the public health nurse is earning versus someone in the private sector, and also in terms of benefits?
I mean, Umair can probably speak to this as well, and of course, it as you well know, depends on where you live in this country. In Connecticut, a public health nurse working in a local health department might make, $65,000, $70,000 a year. It used to be when you worked in the governmental sector, because I've worked at the state governmental level as well, that we offset lower salaries by richer benefits, but that has diminished over time. So the benefits are not as rich anymore in the public sector. A private nurse, working in a hospital or doing comparable work for a temp agency probably can make $10,000, $20,000 a year more. And I would look to NACHO. We may have additional data on this, as many of our members, as I spoke to earlier, have struggled with this, actually losing their public health nurses into other agencies.
And then
Thank you.
also seen, Congresswoman, is that epidemiologists, for example, will get recruited by hospitals to be infection control practitioners because they see them as being good at disease control, better sometimes than nurses. And so you now have, it's not just nurse going to nurse, it's an epidemiologist going to a completely different position that pays higher in that private sector model. So I think that's another piece that needs to be looked at.
Thank you, Madam Chair.